Hi everyone, my name's Claire and I'm Director of Pressure Point Training and Clinic in Arnold, Nottingham. I'll be doing a presentation on why didn't I think of that, and it's just based on 25 years of practice, whether it's with students or clients. Some of the things I now think are completely normal. If you're brand new to your training or your practice, you might actually pick up some points from this video, which I'm really hoping for. So hope you enjoy it. Why didn't I think of that? The first point I'm going to talk about is listening and listening skills. Now I know that sounds really obvious, and you're going to be listening to your clients as they come in. But I'm just going back to the first time really when I trained quite a few years ago, and thinking I became a bit obsessed with the amount of time I spent working on my client. Kind of in my head I thought 60-minute appointment was 60 minutes massage, and if I did less than that, I was thinking that they're not getting their value for money. So I've changed that completely now, and I think especially in appointment number 1, that's when we're finding out all about our clients. We're finding about the medical history, we're doing our consultation. So maybe the first 15, even 20 minutes might actually be working with your client, doing your subjective assessments. In terms of communicating with your client, 7% of communication is verbal. And verbal are the exact words that you use to talk to your client with. So make them specific for the clients that you've got in front of you. General member of the population, potentially not much anatomical knowledge. We don't want to be talking specific muscle names or bone names or even medical conditions really. The other week I had a doctor come in, and I told the doctor to lie face up on the couch, and he looked a bit confused. So I said, "Oh, please lie supine." And he said, "Ah, gotcha." So it's using the words that you need for your specific clients. 33% of communication is actually vocal and how you say things. So using your tone, the pace, pausing at the correct time to let your clients actually talk. They have so much information. They're the only ones that know about why they've come in and their conditions, where the pain is and the problems are. So make sure you let them talk to you. And finally, 55% of communication is visual. So it might be your body language, it might be your facial expressions, it might be the clothing that you wear. So think about that, think about your presentation skills. But listening to your client is the most important thing you can do in a consultation. And it will actually lead to a more effective, productive and positive experience for them. My next point is clients don't tell you everything. Well, could actually call that clients don't tell you anything sometimes in a consultation. Sometimes I look down the consultation list at the medical history. No, none of that. And I'll say, well, you haven't had enough time to actually read the information in the first place. You sure you've never had an operation before? And then that's oh yes, I have. How far back do you want me to go? I say, well, as long as you think is relevant. But there's some clients that you get on the couch that haven't told you any information at all really. For example, I had an 82-year-old retired gentleman in last week. Lovely guy. He's just trained to be a pilot. I know, he's amazing. He was on my couch and I was doing a back treatment and noticed something on the back of his scapular area. It was a mole about the size of a 1p coin, a bit crusty. I did point it out to him and asked him if he knew about it, and he just kind of, I've got things all over my body, don't really know. So I said I would recommend highly that you go to your GP. It's probably nothing at all, but definitely go and get it checked out. So you will find within your treatments things that people haven't told you about or pointed out at all. A client of mine a few weeks ago had a very dodgy hip. So when he was running, he got hip pain quite a lot. Normally I go to that area in the first treatment and have a look, but I assessed him from the feet up. So I did a postural assessment, and during this I found that he had quite a big scar on his ankle. He told me that 10 years ago, I think it was, he had his ankle operated on and they fused it at some point. There was definitely limited movement. So his dorsiflexion on one side was 15 and on the other side I think it was 0. And he wondered why he had a painful hip. So questions that you can ask in the consultation, but also things that you do find. There was one client once that I had a look on their back and they had a scar from about there to there. completely forgot to tell me that they broke their back 3 years ago. I mean, to me, that would be a whole lifestyle change and a major thing in their life, but they really didn't think anything about it. Also, when you have clients on the couch, they might react quite differently to your treatment. I've had people laugh. I mean, I'm quite funny, so that's probably why. They cry. It's not that it's that painful, but the emotional response that you get from your clients is just amazing sometimes, and it also surprises the client themselves. So look out for any kind of irritated skin, rashes, bruises. Make sure you are pointing them out to your client so that they don't think you've caused them as well, is another point. My next point is don't ask, don't get. And this really follows on from the last few slides that I've explained about. It's talking about the relevant questions that you can ask your client. Now, there was a book written in 1936 called How to Win Friends and Influence People by Dale Carnegie. And in his book, he talked about how people don't ask enough questions. In fact, the most complaints made after any kind of conversation, whether it's an interview, a first date or a work meeting, is, I wish they had asked me more questions to find out about myself. So we need to give that time for clients to answer these, tell you a bit about their lifestyle, etc. On my consultation form, one of the points is, it just says diet and lifestyle, and it's not going to be a word that I read out to my client and ask them diet, lifestyle. We need to be asking more probing questions. So in this section of the consultation form, I think it's really relevant that we ask about, for example, do they have children? Now, why would I want to ask this? If you've got children yourself, especially if they're maybe up to the age of 3, you know that you spend all day moving them around, putting them in and out of car seats, lifting them onto play equipment, and that in itself can cause lots and lots of back issues. Also, parents, mothers, fathers, aunties, aunts, they're going to be holding them here up on their hip. They normally have one big bicep, one hip up. That could be leading on to scoliosis, for example. So children is a big one there. The type of jobs people do, it could be a plasterer that is plastering ceilings 8 hours a day with their arm in this position. So knowing about jobs, are they sat at a desk all day, 8 hours a day in this position, might start in this position, probably ends in this position. But occupation is important. So what other kind of probing questions can we ask? I mean, it is important to ask open-ended, to let them talk about themselves. But if they're not really engaging too much, then we need to think of what questions to bring out the most important information we can with our clients. You may be wondering why I've got these pictures on the PowerPoint. Well, this guy is a client of mine. He's a paraglider and lost his leg about 10 years ago. Well, I actually know he's an amputee, but can you imagine being in a treatment where your client undresses and gets on the couch and they haven't actually told you this? To them, they think that's completely normal. I would say always expect the unexpected with your treatments. Your question you're asking now is, why have I got this picture on the board of a poo floating in the toilet bowl? Well, here's an example. A client comes in with right shoulder pain. They've explained to you that it's worse at night, it's a bit better in the day. You test them as you should do. You test their range of movement, which seems to be okay, and maybe you do some resisted muscle tests. And again, there's no particular pain with this. So the question is, why are they getting pain when it appears that there's no real musculoskeletal problem? Well, here's one idea, and it's not always the case, so please don't quote me, but the gallbladder, if there's a gallbladder irritation or it's inflamed, or maybe a blocked bile duct, so the gallbladder stores bile and releases it into the system to emulsify fat. Now, if that's not working properly, you could actually notice it via stools floating in the toilet bowl. Inflamed gallbladders can refer via the phrenic nerve into the right shoulder. So, as someone once said, where the pain is, the problem isn't. And that's not always the case. If you get kicked in the shin by a horse, you're gonna have a painful shin. But other problems through the body, they work their way through the body, whether it's via organs, it's via referred pain, it's via a verruca on the base of one foot that can also lead to a neck issue because of the way you walk and hold yourself differently. So think outside the box. Try and ask as many questions as you can. Some questions will feel a little bit weird asking, but it's all about you. You're an investigator, you're a problem solver. The more information you can get, the better. Once you've trained as a massage therapist, it actually transforms the way you look at the world completely. I would say you've turned from a normal, average member of the population into a highly skilled, knowledgeable massage therapist. So now inside my head, I'll see the world as a completely different place. The lady carrying a beautiful Gucci handbag walking down the street has now turned into someone with an antalgic gait, right shoulder higher than the left, and possible scoliosis. The child with potentially Ugg boots, I don't think they're actually real ones, but they're walking down the street. This child is seen with ankle eversion, pes planus, and a possible genu valgus as they walk in the shoes that are actually starting to wear away a lot quicker. The runner with the energetic, bouncy, you look at them and you used to think they look like a great runner. Now with your knowledge, you're thinking they've lost all of their energy in their vertical displacement and potentially have hallux rigidity and a restricted talocrural joint. Now, if I'm saying words that you don't understand, there are many courses you can do on gait analysis, so why don't you have a look at those? Pollex. That's the technical name for the thumb. Any muscle that attaches to the thumb is a pollicis. There's a flexor pollicis, abductor pollicis longus. Pollex, that might be your new word for today, if you haven't learned anything else. Anyway, why am I talking about thumbs? The thumb is the most overused and overworked massage tool of your body. And depending on your training, I think old school training was very much thumb based, use of thumb, use of single thumb, friction techniques, reinforced. But that thumb joint, we've only got two thumbs, we need to look after them. They say the lifespan of a therapist's thumb used to be about 5 years. So it's our job now to think how we can preserve our working tool and use different body parts. I'm very much in my clinic, especially when I'm teaching students from scratch, is to get good behaviour from the moment they learn how to massage. So using your fist is a great tool. We call this effleurage du poing. So you can get your whole body weight through straight elbow, straight wrist as you're working through that nice long lever, avoiding the use of the thumb. One I use quite a lot now is an open knuckle. So instead of a thumb, use an open knuckle. It actually feels the same to clients. You can try it out, you can use it, and they can try and guess what you are using for the same amount of pressure. Now you've got 8 fingers and only 2 thumbs. Use your fingers more. You can do reinforced techniques with your thumb, with your fingers this way instead of with your thumb. Elbows, we need to use our elbows more, and especially if you are doing more deep tissue work, reinforce your elbow, lean your body weight over these techniques. So use of elbow. There's no direct evidence about using your thumb joint and suffering with arthritis. So there's nothing that really relates to it. However, any RSI in the joint, there's increased likelihood that you might suffer from osteoarthritis and wear and tear on that joint. So really think about extending the career as long as you can do, changing your technique, using correct body mechanics, and you'll be working as long as you want to work. Next point I'm going to make is called try new things. As Henry Ford wrote, if you always do what you've always done, you'll always get what you've always got. In terms of our massage practice, if you have a client coming in with, again, let's just say a shoulder pain, and you see them maybe 3 or 4 times in over 3 or 4 months, and the shoulder pain isn't getting any better at all, well, it's time to reassess what you're doing. If you're not getting any improvement at all, We're doing the same thing repeated and we're not getting the improvement. Don't become complacent with your treatment. There's no one size fits all when it comes to massage. We don't have a handout sheet with the same 3 exercises for every client. Everything that we should suggest to clients are individual. Every client will come with different issues, different muscle tone, skin type, lifestyle, frame, weight, emotional states. They're completely different and they need to be treated as individuals. So if you've got that client coming in and we're just not getting to the root of the problem, you need to make sure that you are reassessing them. It might be that treatment 2 or 3, you decide to do a postural assessment. And I think I mentioned earlier in the slides, a client of mine that had really bad neck ache once. It was because of a verruca on a foot. I would have never have known that if I hadn't have asked more questions or done that postural assessment. So go out and get trained in different things as well. Don't just do your massage skills. What about cupping or acupuncture or K-taping? There's all different things that you can do. Being therapists, we're inquisitive, we want to learn more ourselves, and we also need to do CPD as well. But bring all those different tools into your treatment. Now, clients will book in for various reasons. I would say maybe the top 5 reasons would be to improve range of movement, be to maybe decrease their stress, might be to help improve the sleep patterns. Definitely, I think the top one is probably to reduce pain that they're in, and maybe to increase the mobility. So after a session, if you haven't got any improvements in any of those points, how are you going to do it different next time? So you need to be evaluating your own treatments, asking your client for feedback. Next time they come in, try something different. You shouldn't ever do the same treatment twice. The best diagnostic tool you have as a therapist is actually your client's own finger. Don't know if you've ever asked your clients to actually point to where something hurts, but how they point to an area of their body can actually explain some of the pain or the symptoms that they are getting. A client is the only one that actually knows what it feels like. So I can put this into words, but sometimes it's a bit harder to understand what they're talking about. And pain is quite hard to talk about, whether it's a numbness, a tingling, a sensation. Some people might say it feels like water's trickling over their arm or that a spider's running across their skin. So there's different ways to explain it. But if we say to a client with heel pain, so in my consultation, my client says they've got heel pain. In my head, it might be, from my knowledge, I might automatically think it's a plantar fasciitis. So the plantar fascia connects onto the calcaneus here and onto the heads of the metatarsals at the base of the foot. So I might jump to that conclusion, which is completely wrong. So I get them to take the shoes and socks off, and client number 1 will point to here. Come and have a look. What's this bit called here? It's a little lumpy bit underneath the lateral malleolus. It's called the peroneal tubercle. Now, the peroneal tubercle is a part of the ankle where the peroneus longus tendon goes underneath the base of the foot. So if they're pointing directly to that area, I would think it's more a tendon issue, and it's quite specific. Maybe they've gone over on their ankle. Another client with heel pain might say, take the shoes and socks off, and actually show this kind of pointing, really, as in they are showing the whole base of the foot. Now with that, it's not specific at all. It could be a fat pad impingement or fat pad syndrome on the base of the foot. So this one pointing is acute. With a whole hand, it's more of a general symptom. We could say the same with the shoulder. I know I keep talking about shoulder pain, but very common in our clinics. So one client does this. It hurts just there. Might be a supraspinatus tendon issue. Might be impingement or a bursitis. But if they're doing this, it hurts around here and they can't really be specific about it. It's more of a general issue. It could be a frozen shoulder. It could be referral from another body part. So please use your client's finger. It's the best diagnostic tool you have. The point I'm going to talk about is make sure you have treatment yourselves. Here's me having a treatment for my osteoarthritic hip. I had an acupuncture treatment, which really helps to relieve the pain. And we know as therapists how beneficial treatments are. I mean, we do that for a living and we rely on people coming in and booking in with us. How do we expect people to book in regularly with us if we're actually not doing the same thing ourselves? I normally suggest to a client, if they haven't got any particular issues, to book in maybe every 4 to 6 weeks. So we know it's a preventative treatment as well, as we can find issues that clients potentially might have. So I don't think we've got the right to ask people to book in that regularly if we're not doing it ourselves. It's like a nutritionist giving someone a nutritional advice about healthy eating, and then the client goes and they pop out to McDonald's for lunch. So don't contradict what we do for a living. So we need to practice what we preach. I recommend finding a local massage therapist to you, so someone not too far away, and doing treatment swaps. Make sure you put a date in your diary and that every month you go and see them, they come and see you, and you are looking after your own body. You need to make sure that you're investing in your wellness rather than having to spend money on your illness in the future. We need to be fit, healthy and injury free doing what we do. So please make sure you are getting treatments yourself, looking after your own body. And you'll also feel better when you start telling clients that they do need to be seeing you regularly to invest in their own health as well. What a pandemic teaches you. Well, I've learned quite a bit about myself actually since the pandemic, and it's something we never really thought we'd experience in our lifetimes. But on March the 23rd, 2020, when the world shut down, we didn't even know if we'd be back to work at any point, or what was going to really happen after that situation. Personally, I was off and my clinic was shut for 7 months in total on the different lockdowns, and I actually realised how much I miss seeing my clients. So yes, I can help them. I did quite a lot of Zoom calls actually, to be fair. People ringing me up asking for advice, and I couldn't be hands-on. But I miss the interaction, the personal experience, the getting to know the clients. And I kind of thought of it as watching my own personal soap opera. So every month the client's booked in and we'd do a catch up, if they wanted to talk, that is. And I realised how much people trust you as a therapist and tell you things that maybe they don't even tell their own partners. A few examples were one of my guys told me exactly how he's going to propose to his future wife, all very romantic, but he said he hadn't told anyone else that, so I felt privileged for that one. Another one was one of my ladies, and I went through the consultation form. One of the first questions is there any chance you could be pregnant? And she said, well, yes, potentially. It was within the first month, but she was telling me about that and said that her husband didn't even know about that. So we do find out these things, and it is, I'd say the job is a complete privilege to be that close to people and for them to trust you. However, my point is, apart from knowing that, the main thing I took from the pandemic was laundry. And this is the bane of all of our lives if you're a massage therapist. So seeing up to 20 clients a week, I'd say maybe I use about 4 towels or couch cover, 3 towels per client. I was doing 80 towels or washing a week. Taking it to the laundrette, the expense of everything that goes with it. Time consuming, heavy weights, and also not that environmentally friendly, doing it that many times after one use. So now, and it's been practiced for the last 4 years, is I text my clients and I just remind them to bring 2 large towels and 1 small towel for every time they come in for a treatment. And I kind of started off just after lockdown feeling really as though I shouldn't be doing that, because I wanted to provide everything in a nice comfy environment. Now, second nature, all my clients do it. Automatically come in with the towels. They're so well programmed now that they come in, actually set the couch up themselves. They hop on, they know where to put everything. At the end, they put it in a bag, take it away, and they put it in with their own washing. So it is saving costs, but also for the environment, they're just doing it with their own washing as well, and I'm not having to do it after one use. So I would say the main thing I learned was towels. If you want to take that away and use it in your clinic, then I'd say it's a great idea for everybody. What does tight mean? clients will always tell you they have a tight body part. I think the most common one that they would talk about would be a tight back. And generally we find that on people in this kyphotic position. That's where they get the pain, just here on their back. It's really tight. However, the desk worker sat at their desk for 8 hours a day in this position, they might get tightness here. And as they stand up to go and use the toilet, they get in tightness around the front, or potentially tightness at the back. So what does tight mean? Tight doesn't actually tell you much about the issue at all. I would say, if you think of these two examples, so if you want to have a go and copy what I'm doing here, if I go into this stretch, I'm hoping you know what I'm stretching, but I can feel a lovely stretch here down my hamstrings. They feel tight to me. Imagine them as elastic band. So that elastic band that you pull this way, or a guitar string. It's really tight or really tense, but it's in that lengthened position. So tightness can be found, or the feeling of tightness, in a long stretch muscle. But also that chronically contracted position here of kyphosis, with the shoulders forward and protracted. The pec minor at the front could be chronically shortened because it's held in that position a lot during the day. And that muscle will also feel tight. So the word tight we cannot use to actually work out where the problem area is or what to massage. It's using your knowledge, and a postural assessment or a body analysis is a really good way of finding out where these areas are. So the tightness could be a trigger point in the trapezius, and that's where they feel the pain. But what would we want to do as a treatment? It would be to try and stretch out the front, stretch out the pecs, and now that tight elastic band that's held between our scapulas is now shortened and feels more comfortable. So the word tight is something that we can actually think about as being long and stretched, or chronically shortened, and then we have to work out how to actually treat these issues. Visualize the anatomy below. In a lot of the courses I run, especially the level 4 sports massage course, I like to teach anatomy via the use of drawing on the body. So the picture that you see here is showing the back, the trapezius. We do lower hiatus scapula. It makes it a lot more interactive for the students to learn, rather than just looking at a 2D page in a muscle book. So we need to have that knowledge. We need to train more if we can, and really get our knowledge of anatomy higher and higher. Don't be complacent with what you know. I've got a few examples actually. One of my little sidelines is to become a secret massage therapy shopper, if that exists. But I book into different places around. I don't tell them what I do personally, as in I'm a trainer, I teach anatomy. I don't tell them any of that, but I just go and have a treatment and see what I get. There's a few examples actually of not understanding the anatomy below. And I've had someone try and work out the edge. I can't reach it, my flexibility is a bit poor, but working at the edge of my trapezius here, very uncomfortable. You can't work out the edge of a muscle. So my little face here, not a knot. What actually is a knot, and what are bony landmarks, and what are layers of muscle, and understanding, the superficial and the deep ones. Another example was someone was trying to use an elbow to actually try and get rid of my gluteus maximus tendon. Quite uncomfortable, that one. And another one, I had a hot bamboo massage. Someone was rolling over the spine of my scapula, telling me that I had a huge knot just at the top here as it clunked over the bony landmark. I did say it was quite painful, and they said, no, it will be painful getting this knot out. So I've had some unpleasant and wrongly painful treatments, but really it's not because they weren't good at what they did, they just didn't understand what lay below. Muscles. This is how I visualize everyone. So when my clients get weird looks off me, this is actually what I'm imagining underneath. When they're lying on the couch, I'm looking at the fibre direction of the muscle groups. And I mentioned earlier about a certain point here on the trapezius where clients will think it's a knot, but it's the edge of the traps. Whether this is anatomically correct or not, I think it's just how I wear it. But there is a glute max that comes down here that goes into the IT band. There's an actual position here where it will feel uncomfortable when we're working over that gluteal tendon. So use your eyes, use your imagination, visualise your clients like this while they're on the massage couch. So I'm going to tell you how I classify my clients, or how I feel they fall into different groups, and I hope you can identify with some of these. The first one I'm going to call Betty, and Betty is the monthly chat. Now I'm sure you've all got a Betty that comes in. I would like to say I specialise in sports massage and deep tissue work, but when Betty first contacted me, she booked in just after a back massage. When she came in, she was in her late 60s, about 5 foot tall, very, very petite. And I explained the treatment. I said probably, 45 minute would be okay for her for the first time, just knowing that my hands are pretty big and they'd probably cover her whole back. Well, she was adamant she wanted her 60-minute treatment, which was fine. So we got her on the couch and started work. And I went through all the different techniques. I didn't really find too many issues. And I would say I'd probably done the whole back massage maybe in 30 minutes because she was so small. I said, well, we can stop here, Betty, and I'll obviously only charge you for your 30 minutes. She said, oh no, dear, carry on, carry on. And I carried on for another 30 minutes. It was quite a long treatment for the first time. But it did actually make me realise why she'd come to see me. And it wasn't really for the treatment. It was interaction with another human being. It was to give her something to look forward to in the week. And I think especially older people, they might not actually talk to anyone else for days and days. So it's the interaction, it's the human touch, it's someone caring about you for that 60 minutes. So I think we all have a Betty, and they're very important to our business. My next group of clients are Garys. Have you got your Gary in your clinic? Well, Gary has been complaining to his wife for the last 2 years. Gary sits on his sofa every night, maybe doesn't have the best diet, plays some computer games, likes his Netflix programs, is quite sedentary at work. But he has back issues, as you could imagine. So every day Gary's there telling his wife how his back hurts and moan, moan, moan. His wife gets so annoyed with him. She's like, I see this massage therapist, she's really good. Go and book in with her, she'll sort your issues out. Oh no, I don't get any of that. I know I'm fine. He'll keep moaning, She gets so annoyed with him that for his birthday, she buys him a massage voucher. She gives him the massage voucher and he files it away somewhere. So she gets it back out, she rings me up and she books him in. So now he's got a free treatment, he's booked in the diary, and he comes in to see me. Comes in a bit closed, sits down, arms folded. I go through the consultation form and it's very much, yep, no, yep, okay. Not sure what you can do. Anyway, he gets on the couch, again he's quite closed, but throughout the 60 minutes, you can see his body start to relax. He starts to be a bit more vocal. We realise that we've got a few things in common, and he starts talking about football or watching rugby or things like that. So we have a bit of a conversation. By the end of the treatment, he gets up off the couch and says, actually, my back feels a bit better. And then during the aftercare advice, he's asking when he can book in again. So a really positive treatment. And now he's been coming to see me for 2 years, and all his friends come and see me as well. He goes down the pub and tells them all, oh, there's this person that sorts your back out. She's amazing. So I've gone from never wanting a treatment to having lots of recommendations. Have you got a Gary? My next group of clients are called Julie. Julie will do anything to compete. Now, Julie's been training for the London Marathon for the last 4 months. It was her lifetime goal to run 1 London Marathon, and she's done it via a Golden Bond place. So she's raised £3,000 for charity, which is absolutely amazing. And she's putting herself out of her comfort zone and training, and now she's up to 19, 20 miles, which from never having run before is just incredible. But Julie, she wants to do this. All her family know about it. Everyone sponsored her. It's her life goal. So she will do anything to get her to that point of running. Julie's now discovered that she's got certain niggles in her body, her knee aches a bit, her hip aches a bit. And she's now one client that whatever I tell her, whatever aftercare advice, whatever stretches, exercise, or to come and see me maybe a little bit more regularly, she will follow to the point. So she's the one client that you know she'll go away and work really hard. Because as we all know as massage therapists, there's only so much you can do in one treatment. So Julie will do anything to compete, and she will listen to all of your advice. And my final group of clients are called Allan. Allan is Mr. Maintenance. So Mr. Maintenance, he did walk in, his first treatment with his little walking stick. As I open my clinic door and look down the corridor, I see him. I actually done a gait analysis by the time he comes to my actual room. He comes in, he sits down, and he has a bit of a niggle. And today's niggle is a hip joint. So we get him on the couch. He tells me all about his life. And when he was in the war and his wife. It's a lovely treatment, and he goes away, he gets off the couch and he feels better, and he walks down the corridor without his walking stick. Now Mr. Maintenance, he books in every month, and he books in, it's in his diary. Every time he comes, I think he feels that he has to have a condition to see me. It's as though he thinks he can't come if he doesn't have any problems. And the next time he comes in, he's got a pain in his big toe. And the next time he's got a pain in his left elbow. And the next time. So he's someone that feels he needs a problem to see me. And I think makes up reasons why, really. I do explain that massage is beneficial to all. You don't need problem areas. But he loves coming in. He comes in with his stick and he leaves without it. My next point I'm going to make is don't say don't. Well, that in itself is an oxymoron or a contradicting group of words. Don't say don't. Well, we respond as people, we like positive reinforcement. Negative things make us feel bad, and we probably tend to ignore advice if it is negative. So how can we be a bit more descriptive about the advice that we give people? For example, the person sat on the computer at his desk with a forward head position in this position. If I said, well, let's have a look at that position. Don't sit with your head forward like that because it's putting all this strain in your upper back. How else can we say it in a positive way? So we might think of things like, imagine you've got this cord at the top of your head here. You might have a little post-it note that sits on your laptop that says lengthen or pull or string or something that just lets them imagine that lengthening from the top. So it's a positive thing to do rather than don't sit with your head forward. It might be that we suggest some mobility exercises. Every half an hour maybe, just do some rotations, get that movement back in your neck, go to different positions just to get a little bit of blood circulating. I've heard a really good thing recently that I quite like using, and it's rest is rust. So if we sit inactive, our body and our joints feel like they're rusting up. So mobility is one of the best things we can do. Now, if you're still working in an office and you've got a photocopier, your toilets are on the second floor, you've got your tea and coffee area, well, give yourself excuses to get up and walk around the office and go and do these things. If you're working from home, what I used to do in lockdown when I was doing Zoom calls all day, and I actually realised how uncomfortable it felt sitting down all day. Every half an hour I'd go and hoover a different room. Well, my house was spotless, but it meant that I was from this position to this position, even though it was only maybe 5 minutes, every half an hour, I felt better, I felt more motivated about carrying on with the day, and my body felt a lot looser. Any movement you do is better than no movement. So let's try and encourage our clients to work more, to move more, and to get that blood flowing. Now the other picture on the board is the high heels. I want you to think of what you could tell the client that wears high heels for 8 hours a day. If you've just said don't wear high heels, again, you haven't listened to the point I was making. What positive things can we say to this client? It might be when you're sat at your desk, take your shoes off, wiggle your toes around, do some going up onto your tiptoes. You're still sat down, but you're getting that movement, you're stretching the calf muscles. It might be when you walk to work, wear trainers instead. We're not telling them not to wear high heels, but we're telling them other ways to get around it and avoid that uncomfortable tightness they feel at the end of the day. The last point I'm going to make for this presentation, and maybe one of the most important, is to be clever. There's always time for rehab. I think people automatically think of barriers. So if we tell them to do certain stretches or exercises, most people will say, I haven't got time, I can't fit it into my life, I've got children, I do that, I work 10 hours a day. We've got to make them understand that there is always time for rehab. So I'm going to show you a few little ways that you can do to help this. Clients also expect us to do all the work, but think for, maybe they come and see you once a month. You're seeing them 1 hour a month, and every time they come back, they expect to see improvements. Well, how about if they're doing something daily? They will see a lot more improvements within that time. And think about it. If they did, let's say 5 minutes per day of an exercise, 5 minutes a day, that's nothing. How many minutes is that in a month? Quick calculation, 2 hours, 35 minutes. So 5 minutes a day is the equivalent to 2 hours and 35 minutes of exercise per month, which is the same as us doing 2.5 treatments. If you charge £50 a treatment, they're actually saving £125 a month. They're doing 2.5 hours of exercise extra to what they would have, and what are they putting in? 5 minutes a day. So be clever. Let's take away the barriers that they've got. I'm going to show you a few simple ones. So the first one is for the glute medius. This is a simple one that clients can do sat at a desk, sat at home watching telly. So just get a resistance band. They come in various shapes and sizes and strengths. So around the knee here, and all you're going to do is squeeze outwards. So squeeze your legs apart. We're going into hip abduction. What muscles are we using here? We're using glute medius, we're using TFL. So let's say if we could do a minute of those and have a rest. There's lots of different exercises we can do in this position. If you want to strengthen up your adductors, maybe get some kind of soft ball. If you put the ball between your knees here and then you're squeezing inwards, so you're getting the adductor group strengthening. Another one we can do from this position, ignore the band here, is put your hands behind your head. So the client in that kyphotic position, this is a really good thoracic extension. So hands behind your head here, make sure the chair's fairly low, and just slowly, deep breath in and exhale, and you just go backwards. You might even feel a couple of little clicks. They're called cavitations, just as the spine is just relaxing. So it's stretching off the pec major and minor at the front, and it's extending your thorax. So 2 simple exercises you can do using a chair, can be at a desk or while you're at work. They say it takes 4,000 to 6,000 reps to change muscle memory. So the constant doing these exercises, and it lays down that neural pattern to your head to process, and things actually become less of a conscious effort to do. So that's the idea behind them. Now, I'm not saying do this exercise 6,000 times, but it is something you can repeat throughout the day. So we're going to do this together. I would like you to take part, please, if you can, and I know I can't see you all doing it, but please, please, please try this, and then also see how you feel the next day. So we're going to do, how many butt clenches can we do in 30 seconds? We could do this as a competition. Let's go. Ready? Now. 11, 12. Zoom in. Oh, halfway. 5 seconds. Oh, that's 30 seconds. Stop there. Ooh, haven't done that for a while. Well, I wasn't actually counting because I was telling you how long we got left, but hopefully you'll be able to tell me a number. We better write it down in your feedback. I think the most I've done personally myself, and I did do it really quick, was 67. But even if you do 1 a second, that's pretty good. Now that's activating your gluteus maximus muscle. So when you're sat down, it becomes lazy. And just by doing that 30 seconds on the hour, every hour, it's going to get that blood rush into the muscle. It's going to stimulate it and get it a bit more active. So think simple. Think of simple exercises you can do and you can give to your clients. Rehab can be fun. It can be rewarding. And it means clients get to their goals a lot quicker than just seeing you as a therapist once a month. So they need to invest in their own time. They need to be conscious of using these activities in between treatments. So I really appreciate you signing in and watching my presentation today. I've gone through 13 points and I'm hoping you've got at least one thing you can take away and use in your own practice, even if it's just this: Pollux.